My name's Kerry, Bennett, Integration Change Manager, and my colleague, Dr Gilbert. So let's just whiz to our slides, and there we are, with contact details as well. Can everybody hear me? Okay. Yeah, super. Okay, so as I appreciate, many of you will know the Better Start, you trusted colleagues, friends, partners of the Better Start Bradford programme, and it is great to see you all here today. If it is your first time that you're attending an event hosted by Better Start Bradford, where have you been? That's what I'll say. But no, joking aside, everybody is welcome. Nobody's late to our party. We welcome everybody, no matter what your role, and we ask Bradford and Airedale to hold babies in mind as we learn and evolve together at an individual, place and system level. So firstly, I think it'd be useful just to give a little bit background and context to what brings us here today. So as you will see, Better Start Bradford. In 2015, Bradford was named one of the 5 Better Start sites, joining Blackpool, Nottingham, Southend-on-Sea and Lambeth after a successful bid by a number of partners in the district. A Better Start is a 10-year National Lottery community-funded programme focusing on promoting good early childhood development. The programme funds local partnerships to test new ways of making support and services for families stronger, so that children have the best start in life. The bid criteria had to match a required population size and where communities experienced high levels of deprivation. Bowling and Barker End, Bradford Moor and Little Horton were chosen for their geographical proximity and the indices of multiple deprivation. The programme is grounded in evidence and research, and our research partner is the Innovation Hub, which is part of Born in Bradford. This bit's a mouthful. The Born in Bradford Better Start Birth Cohort, I've been practising, more commonly known as BIBS, we'll refer them to as BIBS, offers a groundbreaking study of babies born at the BRI since 2016 and live with one of the 3 wards of Better Start Bradford. It's also really important to mention here that the Better Start Bradford is governed by a partnership board, a true collaboration between community, voluntary sector and statutory partners. The community board members are a vital part of the partnership board, providing an authentic voice of parents and the communities in the area and bringing a real community influence to the decisions that we make. Better Start Bradford is place-based and aims to create approaches, relationships and services which better support people and communities to thrive. To do this, we've set up over 15 individual projects, and many of our project leads are here today, so it's great to see you. And these services are delivered to families with children between 0 to 3 years who live in the Better Start Bradford wards. The programme objectives, so all the 5 sites have the programme objectives around social and emotional development, language communication skills and health and nutrition. And we are evaluating the projects and their impact as we test and learn what interventions are acceptable to families and the workforce, if they improve outcomes and reduce health inequalities, and by increasing the evidence to what works for young families living and growing up in deprived communities here in Bradford. You will already see many of the projects that have been initially tested in the Better Start Bradford area now being scaled up through the Start for Life investment. And the maternal and early childhood sustained home visiting programme that is delivered by the Bradford District Care Trust, which is an enhanced health visiting offer. So that's great to see that being rolled out district-wide now, our learning. While we're celebrating Bradford babies this week, I want to mention another celebration that's taking place within the Better Start Bradford partnership. As I previously mentioned, the BIBS team work with families and their data to understand what impacts on their health and well-being, and have been able to translate this research into tangible and meaningful change in our city. The BIBS team continue to extend a warm invitation to families to be part of this wonderful research study. Recruitment is ongoing, and all families in the Better Start Bradford area who have welcomed new life at the BRI since 2016 are eligible to take part. And you will have already seen, or if you haven't already, do take time to talk to the BIBS team who are here today, who are ready to engage, to listen and to share their learning. So please take some time to go and speak to them. But I would also like to take a moment to mark an epic milestone for the BIBS cohort, birth cohort, as we now welcome there we are, I did that. Welcome the 5,000th baby into the family. BIB stands as a beacon of dedication inquiry research that's working to understand how we can provide children with the best foundations of a healthy, happy life. So please join me in celebrating this huge achievement for the BIBS team this morning. The final fourth objective for the Better Start Bradford programme is about system change. This is to change for the better the way that local health, public services and the voluntary and community sector work together with parents to improve outcomes for children and to shift attitudes to spending towards preventing problems that start in early life. We are doing this in a number of ways, via a comprehensive offer of community engagement, by strengthening the evidence of why we should and continue to invest in prevention and early interventions to our most vulnerable citizens, and by supporting a well-resourced and skilled workforce by training and capacity building for both paid staff and volunteers. I think one of my slides has gone. I'll just talk. The programme is committed to support and develop the early years workforce. We know that behaviour change in families is very closely linked to the skills and competencies of the people working with them. It is therefore vital that we share the best available information and emerging evidence. We know a confident, capable and skilled workforce centred on meeting the increasing needs of babies and children and families is essential to achieve our vision to enable all children to have the best start in life. Baby Week Bradford is just one of the innovative ways that the Better Start programme reaches out to the wider district to be able to share the learning, to promote key messages, to invest and to celebrate the incredible early years workforce and the importance of everything that we all do. So it gives me pleasure now to hand on to my colleague, Dr Claire Gilbert, and she will take our attention back to one of those third programme outcomes that we saw, and we will explore further around health and nutrition and how it is vital during pregnancy and the early years of life.
Thanks, Kerry. So I think it's lovely to see so many familiar faces in the room and to be back with Better Start Bradford for this event. I'm really excited to be here today. I'm just going to touch on some of the work that I did during my Future Leaders post at Better Start Bradford. For anyone that's interested in the Future Leaders programme or public health training, I think both of those are recruiting at the moment, so do catch me during the event if you would like to. What I'd really like to do in this part of the session is to really think about all of you that work across Bradford in different roles, different parts of the system, to really empower you to think about how you might support healthy weight and nutrition of babies in Bradford. I think this is an approach that Dr Saheo Abbas often talks about when he's talking about reducing health inequalities. No single person is able to address this alone. It's through the collaborative efforts of all of us that we might really make a difference. So what I'm hoping to touch on is to just give a little overview of why living with excess weight and obesity in pregnancy and early childhood is a particular challenge in Bradford, to raise awareness of what healthy weight and nutrition services exist across the district, and to discuss an example of one of our Better Start Bradford projects where it's making a difference. So Dr Amir's already mentioned about some of the challenges that we face in Bradford. So we mentioned about us having a very young population. We have a very high proportion of children, for example, and more than a third are living in relative low incomes. If we look at how many are living with excess weight or obesity, over 2/3 of our adult population are living with excess weight or obesity. And through the National Child Measurement Programme, we have information around levels of excess weight and obesity in reception age and in Year 6 across the country. And we found in Bradford that more than 1 in 5 of our children are living with excess weight or obesity at reception age, and that increases to more than 2 in 5 by the time that they're in Year 6. Now, this is summarised, this is the sort of public health data that we often use. And the main take-home here is that there's a lot of red blobs, which means that we're statistically significantly worse than the England average. But also to bear in mind that we're also statistically significantly worse around underweight. So when we're thinking about how we might approach families struggling with living with overweight and obesity, we also need to think in that context that there are also families that are really struggling for their children to have enough weight and enough to eat. This is very much an issue around health inequalities. So these graphics are not that easy to interpret, I don't think, but the one on the left is around the proportion of women living with excess weight or obesity in pregnancy. And the main take home is that the higher proportion of the pink, darker pink and very dark pink in the most deprived deciles compared to a smaller proportion of the pink on the right-hand side in the least deprived. And similarly, if we look at deprivation scores in childhood, then we see that nationally obesity rates are more than twice as high in our more deprived populations. So I'm sure that most of us in the audience are well aware of some of the risks and harms of obesity for children and young people, thinking about the risks of prediabetes and joint problems, breathing problems and problems in adulthood. But there's also that wider emotional and behavioural context, the stigmatisation, the bullying and the impacts on their willingness to go to school that makes this an even bigger challenge. Now, if we look at living with overweight and obesity in pregnancy, what I've tried to summarise on the bottom is the information on the top to show how one thing can lead to another, and it can end up setting up a cycle that makes things worse and worse. So we're living in a very much an obesogenic environment. We're living where it's difficult for people to get access to healthy food. It can be difficult to get access to green spaces, to live in a healthy way. If we've got a high proportion of adults that are living with excess weight or obesity, then we have a higher proportion of women when pregnant that are living with excess weight and obesity. As Dr Amir mentioned, that increases the risk of low birth weight, but also higher birth weight babies and of complications in pregnancy. Higher birth weight babies are more likely to become obese during childhood, and those children are more likely to become adults that are living with obesity. In addition, if you are a child that's living with a parent or carer who themselves are living with excess weight or obesity, you as a child are more likely to yourself have excess weight and obesity. And so it sort of cycles and spirals. So I guess one of the questions to pose to ourselves as professionals working across this in this area is, where are our opportunities to intervene? Where can we potentially make a difference within the limits of what we could potentially do? Now, as mentioned, obesity is now one of the most common risk factors in obstetrics. All pregnant women should have their body mass index calculated at that antenatal booking appointment. So that is potentially an opportunity during engagement with services to have a brief conversation about healthy weight and exercise during pregnancy. But from national data, we know that nearly a fifth don't have their body mass index measured at that opportunity. So are we doing it in the first place, and are we using that as a chance to have a conversation? In addition, we find that the proportion of women that are living with excess weight in pregnancy increases as the mother gets older. So perhaps there is something that we can offer for older mothers who are at higher risk of complications in pregnancy for other reasons as well. Furthermore, if you look at weight gain between pregnancies, many women don't manage to lose the weight that they gained during their first pregnancy before having their second. So is there an opportunity after a first pregnancy to have a conversation supporting women to get back to reduce their weight before thinking about further pregnancies? Now, there are a lot of facilitators and barriers for people to have conversations about weight management during pregnancy. And this paper summarises some of those challenges. So awareness and beliefs about weight gain and management amongst pregnant women, their level of awareness and knowledge about diet and exercise, their perceptions about risk, their perceived control over their health and weight gain, some personal insecurities, the relationship that they have with their healthcare provider during pregnancy, and social and environmental influence, so feeling judged or stigmatised can all be a challenge. There's a similar paper summarising some of the barriers and opportunities for having conversations with families that have young children. So some of the items that people that are working across the system have reported is things like, I just don't have the time to talk about this, or I don't know how to go about it, or I don't know where to sign people to, or where there's good quality information. And hopefully we will address some of those today. So I will be sharing some of the services that exist across Bradford, and Henry colleagues will be talking about some ideas about how you might approach some of these conversations. And of course, there are much bigger challenges that we're facing around national funding cuts to public health and health visiting services that had a massive impact on the care of families and young children. Some of the structural changes, the removal of children's centres, and Better Start Bradford, as Kerry mentioned, the funding comes to an end in 2025. So our projects the funding for those will cease. Similarly, there's things like reducing inequalities in communities. It's a 3-year funding project. Start for Life is a 3-year project. So it can be really challenging around service provision. So what I'm hoping to do in the next few slides is to give an overview of some of the projects and services that focus on individuals and families in Bradford related to healthy weight and nutrition in pregnancy, and for children and young people across the district. This is part of a wider whole systems approach. So there's a lot of wider work that's going on around the Sustainable Food Partnership across Bradford, and access to green spaces and all those sorts of things. But here we're really just, in the interest of time, just focusing on those services for individuals and families. So across a lot of different areas, the Thrive model has been used for thinking about our levels of services, and we've tried to adopt this, and thanks to Kirsten Foster, who worked with me in the early part of this project and really thought about how we might use the different levels to describe services. So level 1 is around a universal offer within that particular geography or population. Levels 2 and 3 are a bit more targeted, so level 3 might be more extensive support. And we need safeguarding, crisis and inclusivity embedded in each of those services. And we've summarised that as a plan on a page, and I've asked colleagues to share this with you by email after this event. So within this, we've divided it into pregnancy, early years and school age, and within each section, that level 1, level 2, level 3 offer. So, for example, Healthy Start vitamins are available to every pregnant lady in Bradford for free from their health visitors. That's a universal offer. But after they are 6 months old, that is targeted based on their income. So that becomes a level 2, a more sort of targeted offer. So there are various services that do exist. There's Bradford encouraging exercise in people, for example, for people that are pregnant and have a high body mass index. And the reason that we did this work was that through conversations I was having with people working across the system, it was quite complicated to keep track of what's available across the whole district and at what level and who for, what's available in the Better Start Bradford postcode areas, what's available in the Reducing Inequalities in Communities GP practices. So this tries to summarise it on a page so that if you've got someone in front of you, you know where to what's available. So we mentioned we were going to touch on one of our programmes. So Henry is a parenting programme that includes information about healthy weight and exercise and sort of boundary setting and different things. And our Innovation Hub colleagues formally evaluated the impact that Henry was having. So it's a programme of 8 sessions. And at the end of the contract, we found that parents reported improved confidence, better boundary setting, particularly at meal times, snack times, having more time for themselves, sitting down together to eat as a family, reducing how often the TV was on at meal times, and improvements in the types of foods that's eaten. So Henry is available across the district. And one of the things that we did was an analysis of what impacts service uptake for Henry. And this is the kind of approach you could use in any of the services that you're involved with, where you might be thinking, how can we help promote this in our particular area? So this is a framework from the Behavioural Insights team called EAST, and we think about making it easy. Is it a place that families can get to? So one of the achievements for the Henry Better Start Bradford offer was that it was one of them was co-located in a school, which was highly successful. Making it attractive, making sure that parents know if there's a payment, so this is a free offer. Making it social, so they really enjoyed that it was in a group and getting to know other parents, for example. And making it timely, so at a time that they might be able to attend, or they're more receptive to attending that service. So, for example, there's a Starting Solids workshop, which is very popular, and that often leads into greater interest to do a bit more, get a bit more sort of parenting support from a programme like Henry. There are a number of different resources that are available to support practitioners across the system having conversations about healthy weight and nutrition. So there's the FYI website, which is a directory bringing together information all across the district run by the council. And we've got colleagues from the FYI here today. We've been working together to make sure that all the services that we've mentioned are navigatable through this system. Similarly, there's Living Well that's run by the Bradford District Council Public Health team, sort of a range of different services all coming together under one brand, and that's very much taking that whole systems approach. And there's a lot of information for sharing with families, for example, during pregnancy and in early years about food and exercise. There's also a wider West Yorkshire offer that's called the West Yorkshire Healthier Together resource, and so that includes places like Leeds, Calderdale, etc., and making sure that that has links to our services, because some of our families will go to different parts of the system or different parts of West Yorkshire for different parts of their care, and to try and bring that all together. And then, in addition, there's information on the Start for Life website. So, to an extent, it can be a bit of information overload, but I would sort of encourage you to get familiar with each of these and think about what works for you for the sorts of conversations that you might be having with the families that you encounter. So, what can you do? So, I'm hoping that we've given you a greater awareness of the scale of living with excess weight and obesity in childhood in Bradford. We've touched a little bit on some of those opportunities across the system, but I guess to really encourage you to think about using a making every contact count kind of approach, having a brief conversation with the families that you encounter about healthy weight and nutrition where you think that's appropriate. We've shared some of the resources that are available to support some of those conversations or to share with families. They can be translated, so they have translate options. They can be read aloud. They can be messaged to phones. It's really quite advanced what these websites can do now. Think about providing healthy options in the services that you provide, whether you're in an early years setting, for example, or running a playgroup. Consider ways of reducing living with excess weight and obesity across the life course. So just the idea that there might be different opportunities at different stages to intervene. And touched on some ways that you might influence service design. So if you notice that there is a lack of service in your area, for example, or if there's a way that you can make your service more accessible to families by thinking about where it's located and whether it's on at a time that families can feasibly get there. So the aim of this session was to empower you to consider about how you might support healthy weight and nutrition of babies in Bradford. I've given a bit of an overview of why living with overweight and obesity is a particular challenge in Bradford, raised awareness of what services exist, and described one of our Better Start Bradford projects. So thank you very much for listening, and I'll hand back to Dr. Amir.